Good morning, everybody. This is Lori Wilson with you on Community Voice. Happy March 7th. It's Tuesday, and it's a wonderful day, probably the best day of my life. We have here in studio Dr. James Cullison. Good morning, Dr. James Cullison. How you doing?
I'm great. How are you this morning?
I am wonderful. Okay, so we're going to talk urology today, which is what everybody woke up this morning thinking, I want to talk about urology.
That's what I do all the time.
Oh, well, good. So you're the guy. All right. So tell us about yourself. You are with West Georgia
Urology. I've been here over 13 years now. And
wow, you're old.
We have 4 urologists in the practice, and we have nurse practitioners for a total of 6 providers right now. And we are open in the offices of Wadowee, seeing patients there,
Oh,
Bremen,
really?
Carrollton, and Villa Rica, and operate at those locations as well.
So do you bilocate, or what do you're like a circuit preacher, only a urologist?
Yeah, but I would call it more like divide and conquer. We basically move to different places, so we all cover all areas, and we cover call for those locations. So we all move around for coverage.
Okay, that's cool. So you are board certified, and what do the letters FPMRS mean?
I'm board certified in urology.
Mm-hmm.
I'm also board certified in FPMRS, which is female pelvic medicine and reconstructive surgery, which is a newer board certification that came out about maybe 5 years ago.
I want to unpack that. Female
Pelvic medicine and reconstruction.
and reconstruction. Okay, so what all does that encompass? And do we have time for you to even tell us all that?
It basically deals with a lot of complaints that females may have in their pelvis, which can be any kind of bowel or bladder control, pain, prolapse, just annoying things like urinary frequency and urgency.
UTIs.
A lot of urinary tract infections. We've had a lot of encounters with that in our office.
What's with that?
Well,
I hear from somebody, not me, that happens a lot.
It does. I think we've seen quite a surge in that since all
Really?
women were taken off their estrogen replacement therapy over a decade ago for the fear of the risk of breast cancer. And we saw a fallout probably several years after that in postmenopausal females that started getting a lot of urinary tract infections, and that's one gamut of the game. The other one is that we have now a lot of our own bacteria that are inside of us that have become resistant to all the available antibiotics. It becomes a real challenge that your own organisms within you get into your bladder, and it's a little bit of a challenge to get on top of it. So there are women who make regular visits to our office all the time to get this under control.
Wow. Okay, so that's really important. Okay, so talk about surgical and non-surgical options for women.
Well, the first I'd start with is urinary frequency and urgency, or urgency incontinence, which would basically be catchphrase overactive bladder. And coming to our office,
Is that an age thing? I mean, I'm still only 32 years old, and I have been for like 20 years. But
I can tell.
but so this is sounding, this is too self-revelation. Some other woman might say, wow, this sounds really familiar.
Well, I would probably say that any bladder control complaints may be more common with age as it matures. So, but the conservative and non-surgical option and surgical options, for basically the overactive bladder, those 3 different types of complaints that make overactive bladder. Yes, there is a wealth of conservative options, and there's surgical options and therapies as such. And, those can take a lot of time to describe in the office. But there's a lot of medications on the market. We see those commercials with a little bladder pulling the lady around. It used to be the little pipe men walking around. There's a huge market in that. So all these drug companies are investing in this stuff. These have nothing to do with leakage necessarily, like random leakage or leaking
I'm sorry,
in the bed.
I shouldn't be laughing because it's not funny at all. It just seems so strange that it's a thing, that it's like
a common thing.
It's a common thing. Mm-hmm. So bladder medications, it sounds to me like there's a million of them.
There's a lot. They've been around a long time. In the 90s, we only really had 2. Women may be familiar with this because they've been on it. It would have been Ditroban or Oxybutynin, and then it was Detrol. All those have gone generics. And now when the 2000s and this current decade came around, there's probably a dozen. And the most popular too, or like I said, I'm trying not to say names of those medications, but like the one that's advertised so heavily, the little bladder that's pulling the lady out of the, the restaurant or whatever. That is the number one prescribed overactive bladder medicine now. And it's just, in a few years, we'll probably see another one. It's just such a common complaint that there's a lot of drugs targeted on that. And that is the conservative approach first, is diet change, habit modification, and then, try medication.
Okay, what kind of diet, to what diet should sufferers of this phenomenon convert?
Well, believe it or not, as you get older, I personally think not just women, but everybody becomes a little bit caffeine intolerant in several different ways. One of them is in the urinary tract. Your bladder can become very sensitive to a lot of stimulants.
Really? Okay.
Even smoking and tobacco use, I think your bladder, your lower urinary tract can become sensitive to that, and you will start to experience some of these nuisance symptoms of bladder control. So we'll always start from square one, like make sure you're not drinking a lot of caffeine, make sure you're drinking fluids at the right time of the day if you're trying to stay well hydrated. And
all right, so just rule of thumb, 1 cup of coffee a day?
Well, see, that's in the morning. That's a big deal. So, drinking fluids after 6 o'clock at night, the older you get, the more proportion of urine you make in a 24-hour period comes during the night anyway. So somebody might come in and say, I'm getting up 5 times a night. Well, they're also drinking a lot of fluids after supper, after a salty meal, or they just get thirsty before they go to bed and all that. Well, you're playing against yourself, and these common things aren't known that, older you get, your kidneys just kick into gear when you lay flat for several hours. And that's a common complaint. Just I'm having to get up all the time, men and women for that matter. And so, we have to clarify some of these things you're doing that you may not have picked up on.
So when someone comes to see you, that's the first thing you talk about is just like, what are your habits? How much coffee, how much Diet Coke or whatever has caffeine in it?
Yeah, we're required really to do that on paper, like even do a bladder diary. Like we're supposed to make you, like for a month, tell us exactly when you're going to the bathroom, where and what happens and how much did you urinate and all that, and come back and show us these things. Because they say just doing that alone right there self-educates yourself on, man, I noticed that this is blah, 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 blah.
Yeah.
So it makes you self-aware, and then you all of a sudden are doing your own things to make yourself better without us even doing anything. So that's always been a test question on our boards, is to throw the bladder diary out there. For the
bladder diary.
Yeah.
When I woke up this morning, the last thing I thought about was this idea of keeping a bladder diary. But I think that everybody in our listening public right now is changing their lives right now.
We used to have a lot of little cute handouts, a little heart over here and a little time. What'd you do here? We quit doing that because it kind of seemed like it was insulting. So we just have them pull out on a piece of notebook paper and write the time and the date and bring it back.
Okay, so note to everybody, let's start keeping that bladder diary. Okay, because all right, so we have bladder medications, and now.
Then there's therapy, and then there's the non-conservative options, which would be some form of surgery.
Okay, now what on earth is a sling operation?
So this would be out of the. Let me say a couple more things about overactive bladder since we're talking about it.
Okay, all right.
So there's therapy options where there's advanced Kegel exercises and pelvic floor therapy, which would be the therapy, not the. They're still conservative. So appropriate counseling on that, if somebody has the will to do it, that's another thing.
Okay, now, advanced Kegel, I think I know what you mean, because I had a few kids.
Well, you can't just like stop a stoplight and, count to 10 and say, I'm doing this little exercise here. Yep, I'm working out. I'm working out. Or on that commercial, when it comes on. Well, you know what? That's most times is done incorrectly. So there's a little bit of guidance on that. And then there's actually some equipment we have in the office that will make, I don't want to go into details on what those things are.
I can tell you don't. Okay, so let's spell Kegel so people can Google it at least.
Kegel.
K-A-G.
K-E-G-A. K-E-G-E-L.
Oh, so it's German.
Kegel.
K-E-G-E-L.
Like bagel, but Kegel.
It's named after some guy, some doctor?
Could have been a female. Don't know.
I don't know. I know I'm being very sexist, aren't I? Okay, so let's Google Kegel.
Anyway, so that's the conservative therapy is advanced Kegel exercises and possibly pelvic floor stimulation. And then there's surgery, which now we offer, actually it's become very popular, would be bladder Botox injections as well as a...
This is blowing my mind. Bladder Botox, so it makes it expands? What?
No, it was FDA approved about 5 or 6 years ago. They actually we do a little telescope. It takes about 10 minutes where you go in and you inject in 20 little spots with a very, very tiny needle. Botox in all these areas. And not to be cute, but it'd be no different than if you had it all injected into your forehead or the back of your neck for people who have chronic neck pain. It's multiple shots in your muscle in multiple locations to calm it down. That's what Botox does. It's a paralytic. And so it's got all kind of, health applications. And so for the bladder, it's very good. Studies have shown that it works better than all these medications without the side effects, but it's an invasive procedure, not like an operation, but it's an invasive procedure,
Here's what I want to know. I wonder this about all medical procedures and surgical procedures. How do you practice? Because, how do you practice? How did you learn how to do this?
Well, in residency,
yes.
I think I probably did about 800 endoscopic procedures to be qualified to go do it out on my own.
Did your patients know you were in training?
Well, that's an academic institution now. That's how
okay,
that
so
runs.
it's just sort of understood. Yeah.
Yeah, you're backing up on us here. So that's an attending, and then the residents, and that's the educational academic health industry, and that's fairly standard. First of all, how did you decide to go into this specialization? Well, that didn't come up till years later, I should say. In residency and medical school and all that, you just kind of. That's a very complicated question.
It is, isn't it?
I was probably, to be honest with you, I thought I was going to grow up and do.
I'm here to blow your mind. That's why I ask you these questions.
Actually, I thought I was going to do kidney transplants, to be honest with you. I was all gung-ho about that.
Uh-huh.
And then as time moved on and you start to see more things, and that's the problem with medical school in general, is you can't see it all to really know what you like. That's a challenge. So as time moved on, I realized that renal transplants wasn't all that exciting. So,
really?
Yeah, and then after a while,
although it's a miracle, you can take an organ from one person. And
it's one of the best transplants around as far as being successful.
Yeah.
Absolutely. You don't necessarily go into some things because of its success or heroic efforts. It's actually a genuine interest that you might have in the field that just kind of catches you.
Yeah.
And so after you start to see more things, and you start to see the patient come in, and the patient afterwards, and all that, then you just start realizing what you enjoy talking about and exploring.
So here you are at West Georgia. How long are you a West Georgia native?
No, I was born in Mississippi.
No, don't sound so apologetic. Mississippi's fantastic. So how did you end up
I was
here?
not born in West Georgia. Actually, it's quite interesting. I went to high school in Gwinnett County, and then I came back to Georgia after finishing college and whatnot. I ended up living in Augusta.
Uh-huh. Oh, that's pretty out there.
And I decided to move up north to Ohio.
As you do.
And
What part of Ohio? I'm from Akron.
Oh, really?
Yeah.
It was southern Ohio. It was almost darn near Kentucky.
Okay.
But it just didn't pan out. So we moved back to Georgia, my wife and I, and it just so happened my working partner, Kevin McLaughlin, longtime physician here, got a copy of my resume and called me on the phone, and bam.
How did he get that? Was it online?
Headhunters.
Okay. Well, we're glad you're here. We're really glad you're here. And we're going to take our first break. We're going to hear from Tanner Health System for 60 seconds. When we get back, more hard-hitting, penetrating questions, maybe an infelicitous use of that word for Dr. James Cullison. So stay with us. We'll be right back.
In sports, when you play to win, you get your game on. Shouldn't the same be true when it comes to your health? At Tanner Health System, we're going to help you get your healthy on. Tanner is leading the way for you to eat better, get fit, manage or prevent diabetes, and live tobacco-free, so you and your family can get your healthy on every day. It all starts at gethealthylivewell.org. Check out upcoming healthy living events and join others in the community taking action to live well every day. GetHealthyLiveWell.org. Tanner Health System's way of helping you get your healthy on.
Need motivation and support to eat healthier, become more physically active, or quit tobacco? Tanner offers free classes to help you get your healthy on. Register today by calling 770-214-CARE. That's 770-214-CARE. Learn more at GetHealthyLiveWell.org.
And we're back. Good morning, everybody. Happy Tuesday. This is Lori Wilson, still with you on Community Voice. Our guest, Dr. James Cullison, board certified urologist, right?
Correct.
Okay.
Trained as a urologist. That's right.
All right. So that happens. So, okay, we were talking over the break about, and I wrote down, and maybe you can help me understand why I wrote this down. Beyond Botox. It sounds like maybe the subtitle of your memoirs someday. You're right. James Cullison, Beyond Botox.
I can include that.
Okay. I'll give you that idea for free. There you go. It's yours.
So the Botox has been a hot item, and going beyond that, the end of the road for overactive bladder, even though we've covered this quite a bit, would be an interstem implant. It's very hard to explain this treatment option. It's an operation that we do. Interstem, made by Medtronics, the same people that make pacemakers for the heart. It's kind of the re-geared to be implanted other places to control the bladder, and it works. And I have to change those batteries out in the operating room every so often. So it basically looks just like a pacemaker. Like if somebody were going to the airport and go through the airport scanner, like, oh, okay, yeah, I see. That's a pacemaker down there.
Actually, I have a friend who's getting a pacemaker today in her heart.
Yep, and it'll be put right up there in the left upper chest, typically so, and it's got a cable system.
He's looking at my chest, everybody.
Because you've got your hand on it.
Well,
so I'm redirecting him.
So you put a pacemaker in your bladder?
Yeah, it's not actually in the bladder. You're controlling the nerves to the bladder, just like the pacemaker does. It's not sticking in the heart, right? It's controlling some nerves that stimulate. So it's the same concept made by the same company that have redirected it or re-geared it for bladder control. They make them for the spine, Parkinson's disease, and all kind of stuff. So it's the same type of an electrical stimulating device that takes control of some area. So anyway, that's been around for a long time. I've been doing that for 17 years almost. I mean, you just don't hear much about it because it's very hard to explain without pictures. But anyway, that is the end
or
of
sock puppets or something, man. I'm trying to get a visual here, but maybe I don't want one.
I don't think sock puppets will work in that situation. Maybe the Botox. I don't know. But anyway, that would be we've just covered all these treatment options for overactive bladder, which is a very common encounter in our office.
Why does that happen to people of a certain age? Why does that start happening? Do we lose elasticity or muscle or what? I
think the whole pelvic floor in men and women become an issue as you get older because men come in and complain of a whole different set of problems.
Do we want to know what those are?
No, well, we can.
Okay.
But, I mean, that's a whole different. But anyway,
doctors will talk about anything.
I had a talk at the Bremen Elementary School last week, and here's a common thing: women, as they get older, can't seem to keep their urine in, and when men get older, they can't seem to get it out right.
Is that a prostate thing?
Prostate enlargement, and then secondarily will cause bladder dysfunction. But it's all a function of obstruction when women don't have enough resistance to keep it in. So those are completely two different pathways of lower urinary tract issues as you get older. So I would say it's more common with age. These things can happen, but between men and women, it's a completely different presentation and different treatment. Like all these things we just talked about, I mean, you don't do that on men that often.
What kind of complaints do men come to you for?
Well, they sometimes show up with a catheter they can't urinate, or they're getting up several times at night from obstruction, believe it or not. They just don't realize it.
Something else inside gets bigger? Oh.
Well, your bladder is having to push through the prostate and create more power and more pressure to get through an enlargement.
Oh, man. Either way you slice it, getting older is like a really bad idea, it sounds like to me.
Your prostate gets bigger and your brain shrinks. I mean, that's how it works. Yeah.
Have a nice day. Oh, man. I like doctors, though. They have such a great sense of humor. I mean, I guess you have to.
Mm-hmm. Well, it's hard to talk about these things and be all negative. I mean, that's kind of a sad thing when you lose primary function that you've taken for granted all your life, and all of a sudden it's keeping you from going to church, keeping you going to the grocery store. You don't want to go to somebody's house to go play cards because these things aren't exactly in your control, and so you end up being a hermit.
Wow. So what you do not only helps people, but you actually help their standard of living. And
basically everything we just covered is really all about creating a quality of life.
Yeah.
Unlike having a kidney stone and going into septic shock or, having some sort of cancer that we deal with all the time. Those are all a whole different things that are not a quality of life issue, but a true health, compromise that has to be dealt with.
And so the older we get, the more we're going to need you, Dr. James Cullison. Sounds like. He's nodding. That's great radio, by the way. Just nodding with that look on his face.
Yeah, but I'm on camera now, so I can see it.
I mean, that's right. We're on Facebook Live, everybody. And if you have any questions, can we take free questions if anyone wants to call in?
Yeah, sure.
Give us a call if you have a question for Dr. James Cullison, highly trained professional. 678-601-TALK if you have any questions. Okay, let's see. All right, bowel control. Do we want to go there now?
Sure. Let me say one thing. You asked about a sling a while ago when we were off the air. I do want to say
sling operation.
Yeah, a quick blurb about that is the mid-urethral sling, which I've been doing with mesh for almost 17 years. There's a lot of mesh commercials out there. It's very confusing exactly where the FDA stands on that stuff. I'm very aware of what those things are. do you realize the mesh, when I started doing that for just slings only, now we're not talking about for prolapse and other things.
Oh, my God.
In 2000, I can tell you in 2000, I did 4 of those in a row my first year compared to the other slings we were making from scratch or either the standard old bladder, retropubic bladder tack type. It was phenomenally better. It completely was a revolution when it came to that kind of stuff, and that is now considered the gold standard by the American Urology.
Let's back up a little bit and educate me and maybe the other 2 listeners in the world that don't know what precisely is a sling, when do we need it, and what?
That's for stress urinary incontinence, like when you leak, when you cough, sneeze, or laugh, or bend over when you spilled your coffee, or
he's telling me my life.
No. You get on trampoline. The trampoline is the ultimate test, although I will tell the people out there, I'm not telling you to get on trampoline and break your neck by falling off. But
I agree.
But that is a common thing that's one of the questions I'll ask. You're like, when's the last time you got on a trampoline? Because that is the beginning of when you'll start having stress urinary incontinence, when you notice you can't get on a trampoline because you pee down your leg. But when you cough, sneeze, or laugh, and like some people come in and say, I wet the bed, well, they're coughing during the night, and they're peeing when they cough.
Oh, this is horrible. But you're here to change all. You're here to tell us that there's a cure to this one phenomenon of aging.
There's not a lot of good conservative options for that. I could talk about it all day with them when they come to my office, but in the end, if you leak when you bend over to pick up something off the floor for activity-related leakage.
No, there's nobody here in this studio that's relating to this all. No, none of us.
Unfortunately, it ends up being some sort of surgery or either just learning to change some mild things to make it a little better. But we have gone through the gamut of trying conservative stuff to make that. It's just hard.
And
they need some sort of surgical correction.
Is the sling then? Would you say that that's a mild or like a low
It's outpatient
impact?
surgery. It takes 30 minutes.
Oh, really?
Yeah.
That's pretty cool. It looks like we have to take another break already. I can't believe time is just crazy. You also, not only do you do all the miracles you do, Dr. Cullison, but you also make time
Time fast.
Go, just fly. It's crazy. Okay, so we're going to hear again from our wonderful sponsor, Tanner Health System. When we get back, I think we got a couple of listener questions for you to feel.
Already.
They'll be hard-hitting and back-to questions. So take your vitamins, and we'll be right back in 60 seconds on Community Voice.
Do you want to be healthier as a family? Do you want to learn fun ways to exercise and be active? Do you want to find easy ways to add more fruits and veggies to your diet? Parents are on the front line when it comes to the fight against childhood obesity, and you could use some backup. Help your children get a healthy start and call 770-214-CARE to join Tanner Health System's Kids and Fitness program. Kids and Fitness is a free, evidence-based healthy lifestyle program for children ages 8 to 16 and their parents. Developed by a team of doctors and health professionals, the program includes nutrition lessons, physical activity, goal setting, support sessions for parents, and healthy snacks. Register today by calling 770-214-CARE or register online at gethealthylivewell.org. That's gethealthylivewell.org. Tanner Health System's way of helping you and your family get your healthy on.
And we'll jump right back into the world of our urethras. Boys and girls. This is Lori Wilson, by the way, Community Voice. Never in my life did I think I would start a new segment with those terms. But Dr. James Cullison is here to tell us what we can do if we have certain age-related phenomena happening to us south of the belt buckle. How's that? So, Dr. James Cullison, you like that?
Yes, that's a good
you can
expression.
have that. I'll give that to you too. So bowel control for some reason came up over the break. So let's talk about bowel control.
Bowel control has been something that our office has focused more on. It's very hard to get patients in for this, but we get this, and it's hard to have that discussion because a lot of times they don't bring it up right away. They'll have other problems, and then later on when we start seeing them, we'll bring it up. But basically, there are some medications that help with that. There is a lot of diet and modifications that one can do, and definitely caffeine. As I say, the caffeine intolerance really shows up with a bowel later. We really see that a lot. But there's a few medications. There's also some pelvic floor therapy, like we spoke of with the overactive bladder thing. There's pelvic floor therapy as an option.
Kegel, right? Dr. Kegel? Is that what we're talking about?
That's one component of it, yes.
That's Kegel. Advanced Kegel exercises.
But let me tell you about 2 FDA approvals in the last 5 years.
Okay.
One is the same InterStim device I was speaking of, the pacemaker thing for the bladder, which is just a catchphrase, okay, for simplicity. They have now FDA approved that for lack of bowel control as well. So that's, I can't remember.
That would be so horrible.
That got FDA approved over 5 years ago, probably, if I had not mistaken. And that basically will control the urgency and frequency of bowel control, for lack of better words, and maybe some bowel leakage, for lack of better words.
Yeah, that's about as bad as it gets in word-wise.
It actually is fairly successful, more successful than I thought it would be, honestly. Basically that device just kind of triggers all the pelvic nerves to your visceral organs in the pelvis, which is your bowel, your bladder, and some other things, but it's a little bit finicky. I have to manage it. People come back in, I have to control it and change the programming and all that, but that has done wonders. And in the last year and a half, I think the FDA has basically given approval for a new device. It's called the Phoenix, but with an F, Phoenix, and it's
that hurts my heart that you spell Phoenix wrong. But I guess you have to be able to.
I'm sure somebody was paid a lot of money to come up with that word.
Phenix. Is that how they spell it?
Mm-hmm. It's the same company that makes the links for a ring of magnetic beads that goes around the distal esophagus so that you keep from having reflux.
No kidding. What? You're blowing my mind. A ring of what?
It's these titanium covered magnetic beads that are on a string that are surgically implanted. And then they've also now made this for bowel control as well. The FDA has, about a year and a half ago, if I'm not good. Yeah, something like that. So it's relatively new. And anyway, so that's a surgical implant that's complicated. Typically, we would try the InterStim bowel pacemaker type device first if you were to that point. But then this hospital, which might be the only one in the state of Georgia, if I'm not mistaken. Yeah.
Tanner,
has got it on the shelf right now.
No
kidding. Called the Phoenix, Phenix. And we had to start doing it, but it took a while to get it all approved, but it's ready to go. So anyway, that is new.
So this is a day in the life of Dr. James Cullison. Right?
Yes, being here and drinking my coffee.
Drinking your coffee, talking about Kegel, about bowel control, bladder control, and coming up with ways to make people's lives better, people of a certain age. When does this start happening? Like 40s, 50s? What? Whenever.
Your pelvis becomes a nuisance as you get older. We'll just put it that way.
My pelvis has always been out of control. Forget about it.
Now, this doesn't take away from the fact that probably 40 to 50% of those that walk through our door have a kidney stone.
Man. And those can be teeny. I have a friend who recently passed one, and because we're that age now, and it was just teeny weeny. Is it like so teeny? But she was in absolute hell. Oh yeah.
Actually, the smaller they are, the worse they hurt.
Why?
Yeah, that's hard to explain without pictures. But if you look at our surgical log, I bet you probably close to 50% of all the surgeries done in our practice is probably almost kidney stone related.
No kidding.
Yeah.
Okay, so how many minutes do we have left? Maybe 2-ish? Yeah, 2 minutes. Let's get everybody in touch with you, everyone who needs to be in touch with you. By the way, one of our listeners just
by
says,
text? You guys got all the text.
Yeah, I mean, we've got Facebook Live,
inquiry.
phones.
I like it.
Yeah. She says that it's the second law of thermodynamics is that everything works towards decay.
Do what now?
Is that right? Second law of thermodynamics. Everything works towards decay, and we're all falling apart.
Oh, that is an out.
Have a nice day, everybody.
Decay. Your pelvis has decayed in time.
My pelvis is not
under... Well, we need to come up with rejuvenation techniques.
Oh, my gosh. I will pay you real money for that. Okay, we have about a minute left already, and there's so much more to ask. First of all, come back. Would you come back? Do you promise?
If you invite me.
All right, well, we'll get your handler. Right on that. But okay, you have a minute. Tell us what you want us to know, what you want us to be thinking about as we go through the day, having listened to all of this Botox, bowel, urinary talk. Go.
Oh, I would just say, please make an appointment with West Georgia Urology to discuss all those things that may be uncomfortable for you. We've been here a long time, and for bowel, bladder, kidney stone, prostate needs, we have we're in 4 different locations.
Guy, Dr. James James Cullison, 4 locations. Name them. They're
Wedowee, Bremen, Villa Rica, and Carrollton.
Okay. And what's your website?
WGU Urology. WGUrology.com.
WGUrology.com. We are out of time. I am so sorry to say. I had 100 million questions to ask. I was going to get a free consult right here on the air, but instead, we're going to wish you all a good day. Thank you so much for coming, Dr. Cullison.
All right.
And thank you for joining us, everybody. I'll be with you in 23 and a half hours when I make Dick Backert cry like a girl. Until then, have the best day of your life. I dare ya.